When you look at the kidney, you've got the outer cortex, okay? And then you have the medulla. Within the medulla, you're going to have your renal pyramids, somewhere around 6, 8 to 12, up to even 16 of these pyramids. Between the pyramids, you have the renal columns, okay? Renal column, renal column, renal column, and down there. All right, take a look at how you got this three-dimensional renal pyramid. This is the papilla, where you have the widest region of your renal pyramid. That's where the pyramid, or actually the medulla and the cortex, are coming in contact to one another. All right, you can see this little thing peeling away. That's the renal capsule, all right, or the fibrous capsule. So if I pin it here, or if I just put a little sticker there or here, I want you to tell me it's the renal capsule. Please, if I put a sticker there, don't say that's the kidney. Okay? No kidding. All right. Take a look here. These are your minor calyces. Each papilla, each pyramid with its papilla point into a minor calyx. Okay, you see how short this one is. Here's another minor calyx, minor calyx. Minor calyces drain into the major calyx, major calyces, and you see another very short minor calyx that drains into the major calyx. Major calyces drain into the renal pelvis. Renal pelvis continues down as the ureter. Okay, this gland is the adrenal gland or the suprarenal gland. Has nothing to do with the kidney. We're going to talk about it on our last day together. All right, take a look at these tiny, tiny little yellow bubbles. Okay, these represent your renal corpuscles. Okay, what is the renal corpuscle? Two parts to it. The glomerulus, which is capillaries, and the Bowman's capsule. What's the other name for Bowman's capsule? Glomerular capsule. Okay, all right, so let's see. Let's just really quick go over the blood vessels. All right. Renal artery divides to give you the segmental artery. Okay, here's a segmental artery. Segmental arteries are going to give rise to your interlobars. The interlobars are found between your pyramids. The interlobars are going to come this way. You see how they're running this way? And they're found in the junction of the cortex and the medulla. Okay, and they're called the arcuates. The arcuates are then going to give rise to these cortical radiate. Do you see that? Cortical radiate arteries. It's the cortical radiate arteries that are going to give rise to your afferent arterioles. Afferent arterioles are going to give you your glomerulus. The glomerulus is within that corpuscle, okay? But it doesn't end there, okay? Things don't just abruptly end. You continue as another arteriole, the efferent arteriole. The efferent arteriole is then going to give rise to another set of capillaries for you, which is the peritubular capillaries. If you are the cortical nephron, if you're that type of a nephron, you have the peritubular capillaries. If you happen to be a juxtamedullary nephron with a very long loop of Henle that goes into the medulla, okay, then you have the peritubular capillary is going to be called the vasa recta. And it's arranged a little differently too. Okay, so look at the pictures there. All right. So now you've got the peritubular capillaries. Peritubular capillaries are going to drain into your cortical, radiate, or your interlobular veins. Okay, you're draining into the veins now. Okay, the cortical radiate or the interlobular veins are then going to drain into the arcuates. The arcuates are going to drain into the interlobars. Interlobars are going to go straight into the renal vein. Okay, we had a segmental, remember with the arteries, we had a segmental artery going back when you're in the venous when you're in the veins, there is no segmental vein. Okay, pay attention to that. All right, so let's take a look. Let's just take a look at one of these and see what it looks like. All right, you're looking at these bubbles again, your renal corpuscles. All right, regardless of what type of nephron you are, your corpuscle is always going to be in the cortex. All right, let's open one up and take a look. All right, there's my arcuate. Okay, the arcuate is going to give me what? It's going to give me my cortical radiate. Cortical radiate is going to give me my afferent arteriole. And then internally, you can see it because we've cut through it. You can see the glomerulus. All right, here's another one. This is really nice because you see the rest of the nephron. Okay, there's that capsule containing and holding your glomerulus. There's your PCT. There's your loop of Henle. This is the descending limb, ascending limb. There's your distal convoluted tubule, and it drains into the collecting duct. Okay, collecting duct is going to, actually it's receiving from several, and you just see a few, but really there's a whole lot more that's draining into the same collecting duct. The collecting ducts drain into something a little bigger called the papillary duct. And the papillary duct is carrying that urine out through the papilla. Okay, take a look at these little pores. They're representing the openings of the papillary ducts. Okay, and then if that's the urine passing through collecting duct into the papillary duct, passes through that pore, okay, enters where?
Minor calyx.
The minor calyx, right? Okay, so here's one minor calyx. I would have another one, another pyramid here with a minor calyx. These two adjacent ones would dump into, from their minor calyx, would dump into the major calyx. Are we following? Then renal pelvis and out. Okay, perfect. All right, let's take a look at just one of these little corpuscles, okay? Here's the renal corpuscle. We've got the capsule here, okay? The outer portion of the capsule, you've got the simple squamous cells. The inner layer, which is that visceral layer of the capsule, is shown to you in beige. These are the podocytes, okay? I don't know if you can see, but back here, there are no podocytes. It's not that they don't exist. They're just not putting it on these capillaries, on the glomerulus, so you know that that podocyte is covering capillaries. Okay, so if I put a pin on these beige cells, they have a name. They're called podocytes. And I want you to tell me it's the podocyte. If you tell me it's the visceral layer of the capsule, you're not incorrect. But the cells have a name, so I would give you half a point for that. Because they have a name, you give me the name. Okay? All right. So this space, if I want you to tell me the space, I would, obviously I can't just keep I can't tag anything just hanging here. I would pin and I would say space with a question mark. This space is the capsular space. Okay? If I pin out here, I'm right on the capsule, right? I want you to tell me it's the glomerular capsule or the Bowman's capsule. So whatever structure I'm in, that's really important. Take a look at, here's your proximal convoluted tubule. Okay, take a look at this structure here. This is the DCT. Okay, if I have a number here, okay, or if I have a number with arrows specifically to these cells, these are the macula densa cells. Okay, this is representing your afferent arteriole. Okay, bringing blood in. And I think they're just kind of showing you, they're labeling it probably because they want you to know that there are specialized cells here, okay, that are going to secrete renin for you. All right. What cells? Juxtaglomerular cells. Why is renin a hormone or an enzyme?
Hormone.
It's an enzyme. It's an enzyme. You know what? The old books do call it a hormone. And that's a very recent change. Books are saying it's actually not a hormone. We thought it was. All right, so what does renin, what, I know you, I said don't worry about all the details, but what's the purpose?
Increase blood pressure? Or blood-
Increase blood pressure when it's low. So blood entering the glomerulus, if it's entering with lower than desired pressure, you can detect it. You have this apparatus right here that detects it. Because you know what? There's stretch receptors right here within the wall of this arteriole. And then these cells are going to secrete renin. Renin's in the blood. And then, you know, you've got the whole, this leads to this. What do we, you know? And I said, don't even worry about it. But if you're really curious, go read the. And he's like, no, no, no. Okay. There's more to it, right?
Yes.
More than I said. All right. Okay. And that's it. Oh, another cell that makes the juxtaglomerular complex. There were three components, right? The macula densa, the JG cells, and then you've got these cells here, okay? The mesangial cells, okay? Secreting erythropoietin, which is a hormone, okay? Erythro, do you remember what that means? Red. So it's a hormone that's going to cause an increase in production of red blood cells in the bone marrow. Okay, and this is one of the functions of the kidneys. So if you go back and you read the functions, you're going to see that, oh, hopefully that makes sense, that, oh, okay, so this is where it happens. We've got cells that are going to secrete that hormone. All right, let me ask you a question, okay? What is this? Name the blue vessel right here that's long. It's found between the pyramids where the columns are.
Lobar?
The interlobars. Okay? All right. Name this artery here.
Cortical radiate?
Cortical radiate, aka interlobular. Yeah. So lobar and lobular. Pay attention in the PowerPoints. With the arteries, I mentioned cortical radiate, and then with the veins, I give you the other name. Okay, and it's, you know, give me either one. One's just a newer name. I'm okay if you call it cortical radiate artery or cortical radiate vein. I just gave both of them to you, so you know that they go by two names. All right, what if I pin here, and it's this bubble? Corpuscle, because the corpuscle has two components. And if I pin it, and I'm just pointing to the red structure,
Glomerulus.
that's the glomerulus. Okay. And if I want the capsule only, I can pin here, right? Okay. Any questions? Okay, if you, all right, if urine's coming down the ureter, it's going to go into the urinary bladder, okay? And let's just think about the bladder. Internal wall of the bladder. Gross anatomy. What do you see with your eyes?
Rugae.
Rugae. Important for expansion, right? Just like you saw with the stomach. All right. Name the area between the three openings, the two urethral
Trigon.
openings and the urethral opening, the trigon. Okay. Trigon. What is the muscle that makes the bladder itself? The detrusor muscle. Skeletal or smooth? Smooth muscle. Okay, and at the base of it, it changes its fiber orientation a little bit, and it becomes
The internal sphincter.
the internal sphincter. Okay. All right.
Would you accept that on the test, internal sphincter? Okay.
Yeah, but if I'm on the bladder, obviously we don't have any models, so I would give it to you on a picture.
Oh, okay.
So if you see that I have the bladder and I'm pointing to it, you have to tell me it's the muscle. You know, I would point to the muscle itself. if I want you to tell me it's the internal sphincter, I'm going to be right where that sphincter is. Where's the sphincter? Way at the bottom. If this is the bladder, this is the superior aspect, at the inferior aspect is where you see the sphincter. Okay?
Where we'd see the
But I-
cutaway, it's circular.
Yes. Look at the PowerPoints. Yeah. So there's a PowerPoint that I just pointed out. You know, you're cutting through in a frontal section. You can really see that internal sphincter. Okay. So I think when we were talking about the digestive system, we looked at the internal and the external sphincter as well. Same thing. You know, the internal sphincter is smooth muscle controlled by autonomic nervous system. External sphincter is what you control. Okay? So potty training isn't just about holding the urine, it's all about holding the poop, right? That takes a while. That's why it takes months and lots of accidents. All right. Okay, any questions, guys? Already?